Strep throat has been going around our patients at CentraCare this last week, and what that means is we're seeing more patients coming in with throat infections known as pharyngitis being caused by a bacteria called Group A Streptococcus. Now, Group A Streptococcus is the main bacteria that causes infection in the throat. There are some other bacteria that can cause similar infections, but they're not that common. So the most likely is going to be Group A Strep. But in fact, several other things can cause throat infections or pharyngitis. Upper respiratory viruses are probably the most common reason to have a sore throat this time of year. But if you have a fever, you have a painful swollen throat, it's going on for more than a couple of days, and you've been exposed, it's more than likely going to be Streptococcus. In fact, we see that this strep bacteria is fairly contagious, about a 20% odds of getting it if somebody in your family has strep throat. And the best way to tell whether it's strep and needs an antibiotic or just a virus and it will run its course without any treatment is to do a strep test. So you'll be familiar with, of course, the swabs that we have in the doctor's office, where we swab the back of the throat. It's just a little quick discomfort. Run the test, and we've got about 5 minutes to know whether you have strep or not. Now, people say, these aren't that accurate. I need the antibiotic. I need to have the culture ran and sent to the test, and that culture can take a couple of days to get back. In fact, these are about 95 to 97% accurate at detecting strep, and oftentimes that's enough for me to decide whether you need to be on the antibiotic.